can you do gender identification for my embryos?
Yeah.
And if you can do twins or not.
Okay, yeah. So in the United States, there is no restriction of reporting of the gender of the embryos that we create in our laboratory. So when we take you through the process and we've created the embryos, we do an embryo biopsy, usually on the day 5 or 6 of the embryo growth. And then we submit that biopsy for sequencing in the laboratory. This is called PGTA, pre-implantation genetic testing for aneuploidy. This report will be prepared in about 2 weeks, and when it comes back, you will be able to know the grading of your embryo, whether the embryo has normal genetic chromosomes, 23 pair, 46 total chromosomes, very important because we want this to be a successful pregnancy. And then you'll also know the gender of each embryo. And so you will have the ability to select whether you're going to have a boy or a girl.
What about twins?
So when it comes to embryo transfer into the surrogate, many of our patients have asked us whether we recommend putting 2 embryos in at once and having the surrogate carry twins. I don't recommend doing that for a few different reasons. The first reason is my concern over the health and well-being of the babies, because when a woman carries twins, even in natural pregnancy or surrogacy, there's a greater risk of preterm labor and early delivery of those babies. And in the United States, if a baby is born early and has to go into the neonatal intensive care unit, it can be very, very expensive. And so that's one reason why we don't like to do a 2 embryo transfer. The other reason is because there are other medical complications that can occur during the pregnancy for the surrogate, like high blood pressure, diabetes. All of these medical complications are increased when she carries 2 babies.